For us at New Vision, we really focus on the roots of what's causing behavior, stress, and reaction.
By focusing on the underlying issues in treatment, it increases the efficacy of what we're doing with the young people.
We have a collection of therapeutic modalities that we use at New Vision Wilderness that is very specific and scientific based.
I think our number one methodology is relationship.
Through relationships, traumas can happen, and through relationship, we then heal.
The relational model is the idea of really getting in and meeting the client where they're at and being attuned to where they're at in their program.
But essentially, it's time spent with that person, taking the time to really get to understand them as a person, as a unique individual.
And through that relational connection creates that change.
That's the most necessary component in order to use any modalities.
Brainspotting is a method that we use where we tap into the nervous system and we heal the trauma that has occurred in the body.
We work with youth that have had really early life experiences, even within the first days of life, first months of life, first years of life, where this is stored in their nervous system. This is developmental trauma.
Brainspotting is a chance to get deeper with a client than you're ever going to get with cognitive behavioral therapy.
So it's working at that deeper root, releasing that, and actually creating new neural pathways that don't have that negative energy associated with them.
New Vision has had a relationship with Heartmath, the Institute of Heartmath specifically, since our beginnings.
Heartmath is a tool that we utilize with clients in the beginning, the middle, and the end of their treatment that allows us to see how well they're taking things in and can use their coping skills.
The bigger implementation of how it impacts clients' treatment at New Vision Wilderness is self-regulation training.
We can begin to regulate our nervous system, our parasympathetic system, and control things like anxiety and mood.
One of the large research projects that we're working on right now is going to really revolutionize our understanding of how people experience stress in different kinds of environments.
The wilderness itself is methodology. It is the single most powerful intervention that I've ever been able to find to assist young people.
There's a natural response of nature, just the calmness of the quiet, the wind in the pines.
Being out in remote places allows you to focus on yourself, connect with the natural environment, as well as connect with others around you.
I feel like I can actually do more work in the wilderness.
We use a wide variety of clinical methodologies.
Somatic awareness,
Narrative therapy,
Gestalt,
trauma-sensitive yoga,
interpersonal process therapy,
Quick coherence,
art therapy,
motivational interviewing, and cognitive behavioral therapy.
experiential therapy.
In that moment when the wind is howling and you're looking to set up a tarp just to sit under and have a quiet conversation, and they're struggling to tie a knot, and in those teachable moments that occur in the woods, it's not a methodology you'll have named in a book, and yet that is a major part of what we do.